We need to be doing the right stuff from birth to help people develop the airway that they were meant to have, because we're just missing everyone. And orthodontics is like getting it all wrong. We're just like rearranging the teeth and not developing, or we're making people night guards and they're dying in their sleep from sleep apnea. Like, it's a massive problem. And sleep apnea is related to every chronic disease. And even the people that don't have sleep apnea, but they have some kind of sleep disorder breathing, aren't getting through their sleep cycles. Their sleep is fragmented and they're missing like foundational good sleep.
Do you want to wake up feeling like you're stepping into who you're meant to be, into the best possible version of you? What if I told you that the key to your best life, health, and happiness are all around you? You just have to find what works for you. I'm Hope Pedraza, and I believe that there isn't just one way to live a healthy and meaningful life, and that all you need is a little inspiration to make changes that last from the inside out. Each week, I'll be sharing tangible tips and inspirational interviews to help you on your journey. These are the steps to take to improve your life and live with purpose. This is Hopeful and Wholesome. Hey y'all, welcome back to the show. I have on the show today Dr. Hilary Fritsch, and she is an airway and biological dentist and mother of 3. She's been practicing dentistry since 2006. She's been featured on the Today Show, New York Magazine, Business Insider, Pop Sugar, Fatherly Romper. The girl's been around, and she has so much knowledge to share. Her passion for wisdom is really deeply personal, influenced by her own journey through childhood sleep apnea and a crippling autoimmune disease that really impacted her ability to see properly and to even walk. We're going to dive into that and her own journey with that, which is pretty crazy. Y'all just buckle up for that one. And this passion for wellness that she has translates to helping her patients and families optimize their health. She's the founder of Western Sleep Solutions and Saddle Peak Dental, which are both based on the principles of connecting oral health with the whole body, which is what a biological dentist does. We're going to dive into that too, exactly what a biological dentist is, what they do, how it's different from a conventional dentist. And she cares deeply about how impactful the mouth, proper breathing, tooth alignment, airway, and oral microbiomes affect our health span. And we're going to dive into talking really all things airway. We're going to talk about kids, adults. We're going to talk about the link between things like headaches and migraines and TMJ and gut issues and all these things, all related to airway. This is a conversation that we should be talking about more. And she's going to talk about that too, just the links, how much is linked to airway restriction, how many chronic diseases and chronic symptoms or chronic issues are linked to this. It's really crazy. So let's dive into this conversation and hear all the good things Dr. Hilary has to share with us today. All right, y'all. I'm here with Dr. Hilary. I'm so excited to have you on today. Thanks for joining us, Dr. Hilary.
Thanks for having me. This is exciting.
Yes.
Happy to be here.
Thank you. I'm excited. All the things that in my head that we're going to talk about are all the things I talk about with so many of my clients. I'm excited to get like the expert opinion on all of this stuff from an actual biological dentist. So I'm excited to talk about all the things. So amazing. I know you have, I want to start with this part because I feel like this will kind of lead us into the conversation, but I know you have your own journey as a biological dentist. You have your own journey, like your own health journey. So I'd love for you to share a little bit about that and kind of what led you on the pathway of doing what you do.
Sure. So as a kid, I think I had sleep apnea. I just had like poor sleep. I snored. I was like, kind of had chronic headaches and stomach aches. I remember my figure skating coach used to have to buy me a Coke every afternoon just so I could get through my afternoon training session. And at the time I thought it was like something to do with the Coke, but I needed the caffeine, I think. And then that just went untreated for, a long time. And when I was 18 and went off to college, I started to have arthritis symptoms. Like I first got arthritis in my eye and it felt like I had pink eye, but they were like, it's autoimmune. And then when I was like 20, one day I was running on the treadmill and all of a sudden I just could not put weight on my leg. And I found out that I had ankylosing spondylitis, which is this like degenerative spinal arthritis. Mm-hmm. And at that time I was like really indoctrinated in, Western medicine, like it's genetic, there's nothing you can do about it. And my dad was like, come on, like get outside, move your body, get some rest, eat healthy. And I was like, Dad, I'm just, this is just how it is.
Mhm.
So in dental school, it got worse and worse because I was deep in the system at that point. So I used to take a like ski pole as a cane to school at times because I couldn't walk. And I had to take the dental boards with an eye patch because one of my
Oh my
arthritis was so bad from the stress
gosh.
of the boards.
Holy cow.
Yeah. And I was just like in chronic pain and really kind of miserable and kind of ignoring it, just sort of I was just that kind of a kid, like just get the job done.
Right.
And then I went on a Humira, which is like a
Mhm.
immunosuppressant, basically at one point because the pain was so bad, decided to have kids and had to go off of it. And I remember one time when I was pregnant, I like crawled I was living in Boston at the time and I was like going to the best Harvard doctors and I crawled into this, arthritis doctor's office, like in tears. And he put me on a ton, like 60 milligrams of prednisone. And
My God.
anyway, after I had my first baby, my sister was like, well, maybe you should quit eating gluten. And that was like the beginning of this awakening that I had where I was like, oh, that really changed my life.
Mhm.
And then it's just been a snowball of stuff from there, like looking at toxins, looking at sleep, looking at other things that I'm eating, keeping my body moving. And, but I was like very much indoctrinated in the traditional system. And my husband went to Harvard Medical School. I mean, not Harvard Medical School. He went to Harvard undergrad and then Harvard for his residency and fellowship. We were just like believers in Western medicine, but it wasn't serving me. I was kind of a wreck still. And every doctor that I saw had no answers except drugs. And I just knew in my heart, like, there's got to be a root cause for this
Mhm.
that we can look at. So
Mhm.
I've just been on my own journey to figure that out. And I went from having a traditional dental practice to now opening a biological practice, like super airway focused. And the associate that I have here is like insanely talented biological dentist. So he's been teaching me a lot. And he's just as far down the rabbit hole as one can go. So, uh, but now I have like no arthritis symptoms. I pretty
Wow.
much live pain free. I do have like some tension in my neck, which I think is airway related because I'm working on developing my own airway.
Mhm.
So yeah, it's been a big journey to kind of like detox off of everything and find my own, like heal myself,
Yeah.
basically.
That's crazy. I honestly had no idea that arthritis in your eye was a thing. So that's crazy.
I
That's
didn't either. When it happened, I was like,
what
does
is
this
this?
doctor know what he's doing?
Yeah. That is crazy. Okay, so can you, for those listening who maybe don't know, can you explain what a biological dentist is, like how that is different from traditional dentistry?
Yeah. I feel like it is the future of dentistry because eventually I think dentists will wake up to
Mhm.
this theories, but
Mhm.
basically we like take a really root cause approach. So when a kid comes in with cavities, for example, I'm not just like, hey, we got to do these fillings and get you
Right,
some fluoride.
right.
We use biocompatible materials. Everything's toxin free. We do not use fluoride. We use safe mercury removal, but we also are like, why are you getting cavities?
Right.
Are you mouth breathing? Like that's a big reason.
Mm.
And we also look for chronic infections way more than a traditional dentist. So we
Mhm.
take a CT scan on everybody. We're looking for old root canals that are failing
Oh, wow.
because we want to make sure that those nasties that we know are at the bottom of a root canal aren't getting into the bloodstream and affecting people's health.
Mhm.
We also look for maybe like infections from extraction sites that haven't healed properly. We look at the sinuses. We look at can they breathe through their nose? Do they have good tongue posture? Is their
Mhm.
airway developed enough? So much of what's happening in dentistry is airway related, like grinding teeth, breaking teeth, getting cavities, gum disease. A lot of that is like from mouth breathing or grinding teeth from, having inadequate airway.
Mhm.
And so if we look at more root cause, I think we can be so much more impactful. So that is the big thing that my associate does ceramic implants.
Mm.
When he does extractions, we make sure their vitamin D levels are high enough. We give them high doses of vitamin C that day to help with their collagen production and healing. We do PRF where we draw blood, spin it down, and we use that to get it's kind of like a baby stem cells way to help regrow new bone instead
Mm.
of bone grafting. Yeah, so we try, and the choices of the materials that we use are all biocompatible. We're
Mhm.
really careful with that.
Mhm.
So we know we're not putting anything nasty into the body if we
Right,
can help it.
right, right. Okay, so the airway thing is super fascinating to me. And you said it just then, like so much of what people deal with, all those things you listed have to do with the airway. So can you speak to that a little bit more? Because I know this is so common. And my husband and I have this kind of, obviously I'm not a dentist or a biological dentist, but we have this conversation all the time because he grinds his teeth. He's a mouth breather. And I'm like, there's so many things that I can connect to what's going on in your body. And I know part of it has to do with that. So can you speak to the airway thing, like what that has to do with some of these chronic things that people are dealing with on the regular?
Yeah. So everybody's like, this isn't my problem. I don't have sleep apnea.
Hmm.
And they want to like be like your husband, like, don't, I'm not even doing a sleep
Yeah.
study because
Right. I
I'm not
just
wearing a
snore.
CPAP.
Yes.
Yeah.
Yes. Mhm.
The reality is sleep disordered breathing is also really destructive. And so I kind of think like everybody should get sleep tested if they have
Mhm.
any kind of sleep disordered breathing. But, so the numbers, if you just like Google sleep apnea, are super wrong. 80% of people that have it are walking around undiagnosed.
Mm,
And what we do know for certain is 98.5% of children born today have a malocclusion, which means that they need orthodontics, they need their wisdom teeth out. They're not developing the smile, the jaws, the airway that they were meant to have. So that's
98%. You just said 98%?
98.5%.
That's crazy.
Yeah, basically everyone.
Yeah. Yeah.
I mean, my office has been open for over a year now. I just saw two little girls the other day that I was like, you actually have a good airway. And their mom's a
Wow.
nutritionist. She's not like a brainwashed, like,
Yeah, 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 yeah.
Western medicine nutrition. She's like a really
Yeah.
awakened nutritionist.
Yeah.
And she breastfed them and did, we can talk about all that stuff. She did everything right. And they actually have beautifully developed airways. But
Wow.
pretty much everyone that I see has a limited airway.
Mm.
So it's really, really common. And, I just making a reel on this right now because I think it's really important that we like dial it back. We need to be doing the right stuff from birth to
Mm.
help people develop the airway that they were meant to have
Hmm.
because we're just missing everyone. And orthodontics is like getting it all wrong. We're just like rearranging the teeth and not
Hmm.
developing, or we're making people night guards and they're dying in their sleep from sleep apnea. Like it's a
Right.
massive problem. And sleep apnea is related to every chronic disease.
Right. Right.
And even the people that don't have sleep apnea, but they have some kind of sleep disorder breathing aren't getting through their sleep cycles. Their sleep
Right.
is fragmented and they're
Right.
missing like foundational good sleep. So I'm super passionate about it, like
Yeah,
helping
no,
everybody with this.
yeah, yeah. Well, and that's what I was the conversation I had because my husband's saying he grinds his teeth, and so it started off with like the mouth guard, right? Like the dentist was like, oh, get the mouth guard, whatever, and then he's chewed through God knows how many of those, and then they're like, oh, try this other kind, but he still grinds his teeth. I mean, it's not as bad because he was, wearing down his teeth, and that's what the dentist like, oh, but then he's still snoring. And I told him that, and I'm like, well, I know you're not getting good sleep because you're snoring. And so we got this other mouth guard that basically reposition his jaw. And all of a
Mm-hmm.
sudden, like I hear him snoring like maybe once a night. So my question is, when you're talking about airways, like what are we talking about here? Like what do we need to quote fix?
So if you want to visualize the airway, you're going to be through the nose. And then there's a tube that goes behind the soft palate, behind the uvula and the tonsils, behind the tongue and down, into the lungs.
Right.
And what's happening because we aren't growing forward enough, basically that little tube in a lot of people is like a coffee straw or like a McDonald's straw. Like it's very small. And so it doesn't take much when they're sleeping for their tongue to drop back and
Mm-hmm.
close off the airway. And so it might not be pinching it all the way off, like if you take a hose and pinch it in half, but it may be like you put your finger on the end and the
Mm-hmm.
air is turbulent and the oxygen's dropping. So we are trying to we want them breathing through a garden hose back there. So there's numbers like that I want to see when I look at a CT scan. We have to look, can they breathe through their nose, first of all?
Mm-hmm.
A lot of people can't breathe through their nose, or especially at night. And then do they have adequate tongue space? So is their tongue able to fit up in their mouth, or is it kind of hanging out the back of the garage because they're not wide enough? And so like that device that he's wearing, that's called a mandibular advancement device.
Mm-hmm.
It's like two night guards that kind of hold the lower jaw forward. Yep. So that maintains the airway that you have at night. So it prevents the mandible from falling back and the tongue from falling back. If he wanted to treat his sleep apnea or his airway, well, we won't call it sleep apnea because we don't know if he has it, more root cause, then he could do some expansion and make a bigger garage for his tongue and then do myofunctional therapy to train his tongue to stay up in the garage. It should be kind of suction to the roof of your mouth. Like,
Right. Right.
if he had that posture, then that tube at the back of his throat would stay open. And sometimes mouth tape too, to help encourage your lips to stay closed.
So what are you doing to create the space that you were talking about?
Well, it depends on the scenario. So if he can breathe through his nose, then we don't need to remodel the palate. And we can just move the teeth with clear aligners. But if
it's
he
like
can't
spreading out, it's like literally like spreading it out.
Yeah, like I don't use Invisalign anymore. There's a product I like called Candid, but it's just like Invisalign, but it's like an Airway protocol, and the aligners are shaped differently to help remodel the bone a little bit. But we basically we're just going to move the teeth to get a wider garage, and we can even move forward with Candid just to get, and it'll look better too, because like a big wide smile that goes from corner to corner, it looks really nice. But it also, the reason we know it looks nice is because our brains know that's healthy. When we have a nice big airway, that's a healthier person.
Right.
So we can just move teeth and make that garage bigger. If he needs to remodel his palate, so the roof of the mouth is also the floor of the nose. Like if you take a CT scan, you'll see this bone at the roof of the mouth is also the bottom of the nose.
Right.
So if he can't breathe through his nose, then we need to remodel that bone in order to make this volume left to right wider. And that will help open the nose. So in kids, we can remodel the palate with a fixed expander. In adults, we can remodel the palate with like a Vivos appliance, which is a removable appliance. I have actually one because I'm remodeling mine. This is mine.
Oh, okay.
It's like a retainer with like a key in the middle, so you can slowly widen the palate.
Okay.
Yeah. And then we can also, there's like a few different options. The reason I like this Vivos is because you can also push, there's two keys here to also push forward, because I want to grow my mid face more and get my maxilla out of my airway better.
Okay.
So that is a choice. There's also Marpi, which is like put in with implants, and it has a key, and you'll get a big diastema, but it does open the sutures of the palate really nicely.
Yeah.
So it just kind of depends on the person, what they need.
Right. Yeah. That's so fascinating. So with kids, because you're saying the percentage of kids, which is mind blowing. Is it easier I'm assuming this is probably a dumb question, but is it easier to like start as kids, like to develop the jaw in the right way as kids than, to wait?
Yeah. I mean, this is why I love what Tooth Pillow is doing, because there are so few of us that understand airway. Like I said, we learned nothing about it in dentistry.
Yeah.
So a Tooth Pillow is really amazing because it allows people all over the nation to have access to airway dentistry, and they're going to get like exactly what I would give my patients starting at age 3. So there's a lot of stuff that we can do to help kids before age 3, not dentally related, just like lifestyle stuff. But at age 3, we can get them in a tooth pillow device and start some myofunctional therapy. And that can develop the airway naturally, because tooth pillow kind of gets the tongue up on the roof of the mouth, and then it can do its job as the architect of the face. And you can't breathe through your mouth when you have it in. You're forced to breathe through the nose. So incrementally, kids that can't breathe through their nose will get better and better and better at it. And so then we're going to basically train their tongue to do what it should have been doing this whole time, to help grow their face forward and wide. And they can get this mid-face development like that we can't get any other way.
Yeah.
It's very hard to achieve. Like, I'm turning the screw to try and grow my face forward. But like, if we get kids at age 3 doing that, or even like really any time before age 8, we get this really nice mid-face development. They're going to have better cheekbones. They're going to have better lip support. They're going to have this more beautiful face, but also they're going to be sleeping better all those years and developmentally getting everything that they need. Whereas kids that are mouth breathing, their sleep's really fragmented. That's why they're wetting the bed. That's why they have ADHD type behavior. It's causing tonsil and adenoids to be swollen because the body's designed to breathe through the nose and not the mouth. We see like an array of different kind of symptoms from those kids, and we've kind of normalized to mouth breathing, but it is absolutely not okay. You have to be treating it.
Yeah. Yeah. So do you feel like with the mouth tape and all that, you mentioned it a second ago, but do you feel like that is a good option for people? Like, does that help with any of this that you're talking about?
Yeah, I mean, it depends. Like if you can mouth tape and get through the whole night, that breathing through your nose, then I like use it as a diagnostic tool because
Mm,
then I kind of know like, okay, your nose is adequate and we
yeah.
just need to like make your garage bigger.
Yeah.
So I like it like that as a treatment. Some patients have an adequate airway and all they need to do is train their lips to stay closed,
Hmm.
you know? But some people don't, and just taping their lips shut is not going to solve the fact that they have a coffee straw, you
Right.
know, for
Right.
an airway. But it will help keep their tongue up on the roof of their mouth if they have their lips closed and maintain that little coffee straw. So it
Hmm.
just depends. Like some of our, sleep apnea patients who are overweight, we need, you can't just mouth tape your way out of that
Right.
one,
Right. 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 Yes. Yeah.
I think it's a good tool to experiment with.
Hmm.
And what I'll do is send the patient home with a sleep study and a couple night test and say like, oh, how'd you look? Like this is without the mouth tape. This is with the mouth tape. And so we're not guessing at the results.
Right.
And there are some tests that doesn't cost any more and we can get a couple nights of data.
Yeah. Yeah. That's interesting. I mean, I guess it's one of those things that isn't necessarily getting to the root cause, but could help.
Yeah,
That's
I have a friend who was like super, super fit. Like he he's a very accomplished athlete.
hmm
And he was getting out of the military and they had him do a sleep study as part of his like, I don't know, this package that you go through when you're retiring. And he found out he had severe sleep apnea. And we were all kind of shocked at the time. And he started mouth taping and that's all he had to do.
Oh,
He had a
wow.
beautiful airway. He just had really bad tongue posture.
Yeah.
So for him, it was like a cure. And I've seen patients too that once in a while, that's all they have to do.
Yeah. That's
But that
crazy.
is not that's not the norm. So I
Yeah.
don't
Yeah.
want to
Yeah. Yeah.
mislead people
Yeah.
by being like, yeah, just mouth tape.
Sure. Yeah. Fix everything. Yeah. So what
Uh-huh.
about things like migraines, TMJ? And I know there's like multiple factors here, but what, I guess, what role does that play in things like that?
Migraines and TMJ go hand in hand with airway. And
Mhm.
it's really common to see it in what we call like the young fit female profile. Like this,
Mm,
it's like the last person that you would ever think would have sleep apnea. Like her primary care doctor would never send her for a sleep study because she looks healthy and beautiful.
mhm.
But her airway's too small and her sleep is fragmented. And what happens with women is our threshold for arousal is way lower. So a man's going to like totally collapse into sleep apnea. And we're just going to like have these little micro arousals where we don't totally stop breathing and our oxygen doesn't dip low, but we just like don't get through our sleep cycles. So
Right.
in women, that's very common to see migraines and TMJ in people like that. So they don't have a sleep apnea diagnosis. So everybody's like confused about what's
Hmm.
wrong.
Hmm.
But a lot of times what happens is they had traditional orthodontics and that kind of is typically very retractive. And so their TMJ gets jammed back and they have a lot of tension in their joint and they kind of have to like pull their jaw back to make their teeth fit together. So there's like, and they're clenching and grinding at night because our bodies know if we tighten all those muscles up, it prevents these collapsing tissues from the airway collapsing.
Yeah.
So and then we'll see migraines. And so a lot of women will see migraines in the masseter because this is a big clencher. They start here or in this
Right.
even more common, this temporalis, because this is our big clencher muscle.
Yep. Yep.
So if you're waking up in the morning with headaches, that's one of the top 3 symptoms that women with sleep apnea have. And maybe you don't have sleep apnea, but you might just have upper airway restrictive syndrome. So that's what I have. I don't have sleep apnea, but my sleep is fragmented because my airways, I can't breathe through my nose that well.
Mm.
And so those women will see chronic fatigue is the number 1 symptom. Headaches are the number 2 symptom. And insomnia is like the third, which I think is the body's like kind of knows it's not safe asleep
Right.
because
Right.
so then they just wake up and can't
Don't.
stay asleep. But that's like a big red flag. Migraines and TMJ stuff. Like if you're going to the chiropractor all the time to release your TMJ
Hmm.
and your joint feels really good while here, then what we need to do is like remodel the upper jaw so that your joint can stay in its happy place and the teeth will close together there.
Yeah. Yeah. Well, how long? I mean, I know it's going to depend on the person, but how long does it typically take for something like that, for somebody to like redo all the things like you're talking about and widen and spread, like the
Uh-huh.
repositioning of the jaw. How long does that typically take?
Sometimes it's crazy. Like we get an expander, like that Vivos appliance in,
Hmm.
someone like that. And like 2 weeks into it,
Oh,
their
wow.
migraines go away.
Holy
Yeah. We
cow.
just starting to like release everything and we're not forcing the mandible back every night into it
Yeah.
because this also has like a night guard built into it basically. And
Gotcha.
then, yeah, it's kind of incredible how quickly people start to feel better. Not, that
Yeah.
doesn't happen to everybody, but like this basically really good results on treating
Yeah.
TMJ and migraines. We can even treat stuff like trigeminal neuralgia, which is usually when if you tell someone they have trigeminal neuralgia, which means this nerve is fired up and it's kind of sending shooting pain, dentists will like run for the hills because we do not know how to help those patients.
Mm-hmm.
But
Hmm.
that is often correlated with this airway stuff too. And even those patients, not that I, it's a scary one to start with, but even those patients can be helped by
Yeah.
improving the airway because we just need to release all this, tension that's like happening in the face
Right.
basically through this whole area.
Yeah. Yeah. That's crazy. So with the airway stuff, do you have to find like a certain type of biological dentist that will do all these airway things, or is that a typical thing that biological dentists do?
I would say biological dentists are the most like you could pretty much count on them being airway aware
Okay.
because that's
It's part of it.
part, yeah, it's part of it. And there
Hmm.
is no like biological dentist certification that, so I can't say like for sure that whoever you see, if they're biological, they're going to understand airway, but they usually go hand in hand.
Yeah.
The problem with this airway dentistry is it's just an emerging field. And so there's so few people that get it.
Right.
So kind of, you kind of have to do your homework and possibly travel to find the right
Hmm.
dentist to get you help that you need.
Yeah. 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 That makes sense. So we've talked about the mouth tape, but are there any other things that people can do at home, like before going to the actual dentist, biological dentist, to do that you get the spread and all that? Are there other things we can do, whether it's for the mouth itself or just lifestyle things to help with all of this, the airways and all of that?
Mm-hmm. Are we talking about adults or kids?
Let's say adults, like people listening. Yeah.
Okay. Well, I really like to have a nasal hygiene routine. So that X Clear spray,
Oh, yes. I like that stuff.
that's like, yeah. So
Hmm.
I think that is really helpful. I also like the Buteyko breathing method. He's Patrick McEwen. He's like helping people cure their asthma with breathing exercises. Do you know that exercise? I
Mm-mm.
could walk you through that one if you
Yeah.
want.
Tell me. Yeah.
So what you do is you'll basically exhale everything out, then
Hmm.
close your nostrils with your fingertips like that
Hmm.
and pace the room while you hold your breath. And so count your paces because we want to sort of see if you get better after night. And when you can't take it anymore, you're going to take your first breath in through your nose. And that's the signal to your nose that you want to use it. The nose is like use it or lose it. So if you got to have the habit of using it, it'll be congested and
Hmm.
runny. So you'll feel like your nose open up on that first breath. Then you're going to let your breathing calm down for 30 seconds. Then exhale everything out. Do it again. Pace the room. Hold your breath as long as you can. Take your second breath in through your nose. You'll feel it open up even more. Then do it a third time. And the third time you'll feel it like really open up. So
Hmm.
for me, I like to do the X Clear spray that you take a breathing exercises. Then if you can breathe better when you pull your skin away from your nose like that,
Hmm.
that means you would benefit from wearing a nasal dilator. So there's a ton of them on the market now. It's kind of like a breathe right strip, but there's like mutes and intakes and like a nasal aid, a lot of different options.
Hmm.
Put your nasal dilator on your mouth tape, and then you're kind of dialing in your breathing for like minimal money, minimal effort to make
Yeah.
sure you're
Yeah.
breathing
Yeah.
through your nose at night.
Hmm. Yeah. I mean, that all
And the
sounds
X Clear
simple.
spray, I do blow your nose really good, spray, and people want to spray up, but the nose actually goes this way. So spray back towards the
Mm.
back of your throat. And if you tasted it, you wasted it. So don't, you
That
want to
happens to me
sniff
all the
it.
time.
Yeah, same. I'm like, shoot, sniff it in, but then
Mm.
let it sit as long as you can and
Hmm.
then blow your nose again.
Hmm. And is that like a daily thing you do with the X Clear stuff? Yeah.
Mm-hmm. Mm-hmm.
Okay.
Yeah,
Interesting.
it's like salt and xylitol. So it just kind
Yeah.
of breaks up the mucus.
Yeah. Cause I haven't ever thought about, cause it's like usually something I do if it's like allergy season or I feel like I'm getting, but it's just cause you need clear nasal passages even when you're not adjusted. So it makes sense to use it.
Yeah. Well,
all
some
things.
people are really, really good at using their nose all the time, and maybe they don't need to be using an X-Clear spray. But if you have a fussy nose,
Hmm.
then it's really good to have a nasal hygiene protocol. And it kind of makes up for the fact in some ways a little bit that you're not breathing through it all the time. So like the nose is designed to have airflow going through it all the time. And if you
Right.
don't, then it'll become congested and then that
Hmm.
spray is like even more necessary. But
Yeah.
so kids, nasal hygiene protocol every day is really good. And anybody that has a little bit of congestion, we see
Mhm.
like mucus in the sinuses like every day when we're doing CT scans. So those
Yeah.
patients I always recommend it too.
Yeah. That's so helpful. This is so helpful. And I mean, there's like literally probably a million other questions I could ask you, but for time's sake today, we'll just leave it
Yeah.
there because
Uh-huh.
there's so much there's so many other things I want to talk to you about. But no, this is so helpful. And I think this is a part of like, I don't know, I just feel like this is a part of our health that we don't ever talk about. Like this is a topic that's just not talked about that much.
I
So
know it bums me out because I think it's so foundational to health. Like
yeah.
to me, like a good biological dentist that understands airway and like a functional medicine doctor of some kind
Yeah.
are like this is you're good.
You're
Like you
set.
have like
Yeah.
everything that you need.
Yeah.
Yeah.
Hmm.
But everybody's kind of getting led astray on this airway because most dentists don't understand it. So it's
Right.
just they'll come in as patients and they just finished ortho and they're like, my kid had to drop out of school because they're so tired all the time. And I'm like, we have to totally redo their
Oh
ortho.
my gosh.
And people are mad,
Well, yeah,
and
they just spent 5 grand on braces and then they're,
yeah.
yeah.
And so it's really,
Ugh.
really hard, but hopefully like, so thanks to people like you, we're spreading the word.
Yeah.
And, I think like that when patients understand that they need this kind of help for themselves or for their kids, then that will drive the industry.
Yeah. Yeah. I love that. So good. Okay. I have one more question I want to ask you that I like to ask everybody at the end, but where can people find out more about you? Because like you said, some people might have to travel to, find someone who's helpful. So about you, your practice, all the things you're doing.
Yeah. My Instagram is Hilary Fritsch, DMD. And so that's a really good way to find me. I do try to answer like every question and respond to every message on there. So feel free to reach out.
Mhm.
If people are looking for a good airway dentist, it can be really hard to find. I recommend checking the Airway Health Solutions website. Those are docs that have like taken a course with Airway Health Solutions. So it doesn't mean that they necessarily have the kind of training that I've had, but like they're moving in the right direction. So,
Yeah.
and, check Google for airway dentist and like look for docs that are doing sleep studies, that are using upper and lower fixed expanders, that are starting treatment early with a tooth pillow, or you could look for your tooth pillow provider because that's a really good way to find someone that's airway aware. And looking for a biological dentist is hard too because some people pay to be part of this IAOMT, which is like a kind of nationally recognized register, but
Hmm.
not everyone pays to be part of that. So you might miss out on a good doctor.
I see. Hmm.
So it's kind of like a, doctor finder, and it's also a way to get some training, but like we didn't do our training there, for example. So,
Hmm.
but you want to look for doctors that know how to do safe mercury removal, docs that aren't using fluoride, docs that are taking CT scans, docs that are using zirconia implants instead of titanium if you need that kind of, if you need some kind of surgical stuff. PRF is a good sign. Ozone, like all the biological dentists use ozone. That's
Yeah.
amazing. We love that. So
Yeah.
those are kind of the things to look for on the website.
Perfect. That's so helpful. And I'll put the links to all of Dr. Hillary's stuff in the show notes. So y'all can go check out that and check out her Instagram that has lots of helpful stuff. So the last question I want to ask you that I like to ask everybody, what do you think is the most important thing you can do to live with purpose?
I just think like being introspective about what's happening. So like when I think, like if you asked me that question from an airway perspective, it would be like my advice for your husband, like living with purpose and like really looking at what you can do to feel your best.
Mm-hmm.
So don't be afraid to like get an answer that you don't want to hear because like you don't necessarily, need to wear a CPAP and you don't necessarily need to do more than just mouth tape. You might be one of the lucky ones. So like,
Right.
I mean, I don't know. I'm just like always stay curious and keep
Yeah.
looking for the answers. That has worked really well for me.
No, I mean, yeah, you've got the health, testimonial to prove it. So I think that's really good advice. Thank you so
Thanks.
much for this, Dr. Hurley. This is so helpful for people. So thank you
Thank
for
you.
sharing
Thanks
your
for having me
insight.
on. That was
Yeah.
fun.
Thanks for listening to Hopeful and Wholesome, y'all. If you found value in this week's episode, please subscribe on iTunes or wherever you listen to your podcast and leave a review to let me know what you thought. I'd love to know what you find useful in these episodes so I can know how to provide the most value I can to my listeners. And if you have topics you'd like to know more about, I'd love to hear those as well. So shoot me a message on Instagram, Facebook, or LinkedIn. It's at TheHopePedraza, or you can visit my website, hopefulandwholesome.com. Thanks, y'all.